Why do people avoid going to the dentist? The answer is dental anxiety. Hi, I'm Dr. Spandana Sripada. I've done my BDS from Bombay. I've done my MDS from Hyderabad in the field of periodontology and implantology. So I'm a gum specialist and an implant specialist with fellowships from the American Academy of Implant Dentistry as well as the Indian Society of Oral Implantology. I run my own practice in Khajaguda in Hyderabad called Dr. Spandana's Dentistry. And here we deal with patients with dental anxiety. Dental anxiety is a condition wherein a patient is so scared of going to a dentist that he completely avoids treatment despite the fact that he needs it or he may be in pain. Dental anxiety is as prevalent as 40% of the population across the world. So 40% of the people around you actually have dental anxiety, and even some of them have dental phobia. And this is taken so lightly in this field of ours. Medical fraternity in general does not consider anxiety as a condition which needs to be given importance to and which needs to be catered to. And today I'm here to basically spread awareness about dental anxiety. You may have seen a lot of patients coming to your clinic complaining of the fact that they have had a very bad experience with a dentist as a child, or maybe some of their relatives, parents, or grandparents, etc., friends, family have had a bad experience with a dentist, and because of which they carry trauma for years on end, so much so that they actually avoid going to the dentist even if they are in pain or discomfort. You would have seen a lot of patients coming with extremely dilapidated teeth or in severe pain rather than coming to you when there is a chance for a more conservative treatment approach. Why does this happen? This happens so often is because of, as I explained, some kind of a bad experience that they would have had as a child, or they would have experienced, heard experiences from other people that they have had a bad experience at a dentist. So, what we do, we basically try to just shrug it off, or maybe not give enough importance to their concern and their trauma, their anxiety. We don't really lend an empathetic ear also to be able to understand their problems. Why did the trauma arise in the first place? What was the experience that was so bad that has led them to a point that they'd rather avoid treatment than go to a dentist? We don't sit down and understand and go into the nitty-gritties and details of why the patient is so anxious to get his treatment done, even if you are promising that his pain and his discomfort will actually reduce after his treatment. So today I'm here to encourage all dentists around us to basically spend more time with the patient. When the patient comes into your clinic, take it as an opportunity that you are getting, that you can change his mindset towards dentistry. You can change the mindset of the patients towards dental treatments, and how there has been such severe improvement in dental treatments from 10, 15, 20 years ago, where they would have had a bad experience at a dentist. So what we do here in Dr. Spandana's Dentistry is we actually practice something called slow dentistry, which basically means that we take so much time with the patient to try and understand his concerns, his history with dentists, his history of dental treatments, his traumas that may have arrived from the last dental experience that he has had. What are his main problems? What are his concerns? We take a lot of time in consultation itself, which will basically lead to our better understanding of our patients so that we can help them better. The longer you take with the patient to try and understand his psychology, to try and understand the way he thinks, why he is traumatized by dental experiences, the more you will be able to prepare yourself to make him feel comfortable. The next step is absolute investment in detailed explanation of not only the problem that he has come with, but also the treatment. So even if we make our patient sit on a dental chair and we are pushing the dental chair back, we tell the patient, because when the patient is suddenly jerked behind, the jerk itself can increase the anxiety, right? Similarly, even if you are putting a small mouth mirror or a simple instrument into his mouth to check his mouth, you tell him. Basically, the idea is to explain each and every step to the patient so that there is no ambiguity and he is not left questioning or wondering or worrying what is going to happen next. So every step of the process is explained, is told, so that they can better prepare themselves in order to deal with the treatment that they have come here for. Similarly, detailed explanation of the diagnosis, why that problem has occurred for him, what is the treatment, and what are all the steps of the treatment. This also has to be explained in detail so that the patient is not left wondering what exactly is undergoing. When the patient comes for pain, the moment you see the X-ray, you tell him root canal. But what is a root canal? Why did he have to undergo a root canal? What could he have done differently the next time so that he can avoid a root canal? What are the steps of root canal? How many appointments is it going to take? How many times does he need to be injected? What are all the instruments that are going to be used? What are all the antibiotics that are going to be given? How are we going to ensure that he doesn't have pain or discomfort either during or after the treatment? Being available for him or her at every step of the treatment is the only way that we can battle this problem of dental anxiety. Please let us together try and change this perspective of the general population that dental work is extremely painful and dentists and the dental chair are something that have to be, feared. Let's change that thought process and let's together try and build an era where information is key. You will have to sit down and explain to the patient about his diagnosis, treatment plan, and maintenance protocol in such level of detail, ensuring that all of his doubts are cleared so that he does not enter into this with ambiguity, he does not enter into this with a sense of fear or a sense of insecurity. He feels confident and he knows what exactly he's going through so that he can battle his dental anxiety. We can help him battle his dental anxiety better. Thank you so much. For any inquiries related to your dental treatment, please contact us on the number given below.